Your liver is a silent hero, tirelessly filtering toxins, producing bile, processing nutrients, and keeping your blood clean. But when it begins to fail, it often doesn't cry out with pain. Instead, it shows up subtly on your skin, your eyes, your mouth, and your general appearance. Liver disease is often labeled the silent killer because by the time symptoms appear internally, serious damage may already be underway. That's why it's critical to understand the visual signs that your liver may be in distress. These signs are not hidden deep within organs or blood tests. They show up every morning in your mirror. If you're over 60, your liver becomes even more vulnerable. Years of medication, processed foods, alcohol, and environmental toxins accumulate. But early detection through visible symptoms can prevent severe liver complications, including cirrhosis, fatty liver, and even liver cancer. 1. Yellowing of the eyes, scleral icterus. The white part of your eye, called the sclera, is a powerful indicator of liver health. If it starts turning yellow, even slightly, it's a major red flag. This condition, known as scleral icterus, indicates jaundice, which happens when bilirubin builds up in the blood. The liver normally processes bilirubin, a yellow pigment from broken down red blood cells. But when the liver is compromised due to hepatitis, bile duct obstruction, or liver cell damage, it can't keep up, and bilirubin begins to discolor tissues. What to look for? Yellowing begins in the eyes before the skin. Even mild yellow tint is significant. It may appear gradually and be mistaken for tiredness or poor lighting. Yellow eyes are often the liver's first cry for help. Never ignore them. 2. Spider angiomas, tiny web-like blood vessels on the skin. Spider angiomas are small, red, spider-like clusters of blood vessels that appear just under the surface of the skin. They look like a central red, with thin lines extending outward, much like a spider's web. These appear because liver dysfunction causes a hormonal imbalance, particularly excess estrogen. The liver normally breaks down excess hormones, but when impaired, hormones like estrogen build up, causing dilation of superficial blood vessels. Common areas where they appear: face, especially cheeks and nose, upper chest, neck, arms. More than 3 spider angiomas may suggest liver disease, especially if they're increasing over time. 3. Red palms, palmar erythema. If your palms appear persistently red, especially around the base of the thumb and little finger, you may be looking at a symptom of liver disease. This condition is called palmar erythema and is another result of hormone imbalance and vasodilation, widening of blood vessels caused by poor liver detoxification. What to notice? The redness isn't related to heat or exercise. It persists even at rest. It's not painful, itchy, or hot to the touch. Red palms are seen in up to 23% of people with cirrhosis. Don't ignore them, especially if combined with fatigue or abdominal changes. 4. Dark circles and puffy eyes. While common, persistent dark circles under the eyes can sometimes be more than just a sign of poor sleep. In traditional Chinese medicine TCM, the area under the eyes is considered connected to liver and kidney health. A fatigued liver may struggle to detox the blood efficiently, resulting in sluggish circulation, buildup of toxins, and discoloration under the eyes. Key indicators: purplish or brown discoloration, not just shadows. Swelling or puffiness that doesn't go away with rest. Appearance even when sleep is sufficient. Combined with fatigue and skin changes, this could indicate liver overload. 5. Yellow coating on the tongue. The liver has a surprising connection to the mouth. A yellow-coated tongue can signal liver stagnation when bile and toxins are not flowing properly. What to observe? Yellow, greasy coating, especially at the back of the tongue. Bitter taste in the mouth. Bad breath not explained by dental issues. In traditional Chinese medicine, a yellow tongue is a classic sign of liver heat and poor bile flow. It's a reflection of what's happening in the digestive system, and the liver is at the center of it all. 6. Bad breath, halitosis that doesn't go away. Liver-related halitosis is different from ordinary bad breath. It smells musty, metallic, or like decaying matter. This happens when the liver fails to clear toxins like dimethyl sulfide, a compound that builds up and escapes through the lungs. You may notice chronic bad breath despite good oral hygiene, friends or family commenting on your breath, a persistent metallic or bitter taste in your mouth. In advanced liver disease, some patients develop what's called fetor hepaticus, a distinct, sweetish odor due to liver failure. This is a late sign, but mild versions may appear earlier. 7. Flushed or red face. When the liver is inflamed or congested, blood vessels can dilate to compensate. This causes persistent facial redness, especially across the nose, cheeks, and forehead. You may mistake it for rosacea, sunburn, or alcohol flushing. But if it's present even without triggers, consider your liver. Redness can indicate alcoholic liver damage, fatty liver disease, estrogen dominance due to impaired hormone clearance. Take it seriously, especially if redness worsens after meals or when standing. 8. Dry, itchy skin with unexplained rashes. Liver dysfunction causes bile salts to accumulate in the skin, leading to intense itching, often without any visible rash at first. Over time, scratching can cause skin damage, red patches, and even thicken skin. Key signs: itching mostly on hands, arms, feet, or back. Worse at night or after bathing. No visible cause, no new soaps, no allergy triggers. Itching is often an early warning sign of cholestasis, where bile flow is reduced or blocked, common in early liver disease. 9. White or pale nails, Terry's nails. Your fingernails offer an unexpected window into your liver. In a condition known as Terry's nails, the majority of the nail becomes pale or white with only a narrow band of pink at the tip. This reflects changes in blood flow and protein levels due to liver dysfunction, particularly cirrhosis. What to watch for: nails that look frosted or colorless, white starting near the cuticle and extending upward, accompanied by brittle or ridged nails. If all your nails show this sign and you have other symptoms, get checked promptly. 10. Unexplained bruising or slow healing wounds. The liver produces clotting factors, proteins that help your blood coagulate when you get injured. When the liver is damaged, production of these factors slows down and you may notice easy bruising from light contact, slow healing after cuts or scrapes, bleeding gums or nosebleeds. This is not just cosmetic, it's a medical red flag indicating liver involvement in your blood chemistry. 11. Swollen face or puffy eyes in the morning. Fluid retention is common in liver disease, especially as it progresses. You might notice puffiness in the face, especially around the eyes and jawline, even before hands, feet, or abdomen swell. This could signal hypoalbuminemia, a condition where the liver can't produce enough albumin, a protein that regulates fluid balance. Watch for facial swelling after lying down, puffy eyes upon waking, facial tightness or fullness. If your face looks different in the mirror and you're also tired or foggy, it's time to investigate further. 12. Skin discoloration, hyperpigmentation, or dark patches. In some liver conditions, such as primary biliary cholangitis or hemochromatosis, melanin production changes and leads to dark patches, especially on the face, forehead, around eyes, neck and underarms, palms, or fingertips. The skin may appear bronze, grayish, or unevenly dark, even without sun exposure. This pigmentation is not just aesthetic, it signals systemic liver imbalance and iron overload in some cases. The liver is central to your digestion and energy. It regulates blood sugar, metabolizes fats and proteins, stores nutrients, and produces bile that breaks down food. But when it starts to fail, your body shows it loud and clear. You just need to know what to look for. In this chapter, we turn our attention to visible signs and sensations in the abdomen, stomach, appetite, and even your daily mood and energy levels. If your belly feels off and your strength just isn't what it used to be, your liver may be silently trying to send you a message. These signs are especially important for seniors over 60, whose livers may be more vulnerable to toxins, medications, and age-related wear and tear. 1. Swollen abdomen or unexplained bloating. A growing waistline isn't always just weight gain. One of the most alarming signs of liver disease is ascites, a buildup of fluid in the abdominal cavity. You might notice Your belly feels firm, tight, or rounded. You feel full quickly when eating. Pants or skirts feel tighter, even if your weight hasn't changed. Pressing on your abdomen leaves an indentation. This swelling is due to portal hypertension, where liver damage causes increased pressure in the portal vein system. Fluid leaks into the belly as a result. Even moderate bloating that doesn't improve should be checked, especially if accompanied by leg swelling or fatigue. 2. Visible veins on the abdomen caput medusae. If you look at your abdomen in a mirror and see enlarged, bluish veins spreading out from your belly button like a spiderweb, that's a classic sign of advanced liver disease. It's called caput medusae, named after the Greek mythological character Medusa, whose hair turned into snakes. Why it matters. This means blood flow through your liver is restricted. Your body is forming alternate routes to bypass the liver. Veins become visible as they enlarge. It often occurs alongside ascites and liver scarring. This sign is not normal and not just cosmetic. It's a visible sign of portal hypertension and usually demands immediate medical attention. 3. Changes in bowel movements, pale, clay-colored, or greasy stools. The color, shape, and smell of your stool tell a story about your liver health. If your bowel production or bile flow is impaired, it directly affects your stool appearance. What to look for? Pale or gray stools, lack of bile pigment. Greasy or floating stools, poor fat digestion. Very dark or black stools without iron supplements, possible bleeding in the upper GI tract. In liver disease, bile flow can be blocked or reduced, resulting in cholestasis. Without bile, fat isn't broken down properly, and stools lose their normal brown color. If you need to flush more than once or notice a strong smell, don't ignore it, especially if it happens frequently. 4. Nausea or loss of appetite. One of the most common early signs of liver problems is simply not feeling like eating. While this can be brushed off as stress or aging, persistent loss of appetite is a clear sign your liver is struggling. Why it happens. A sluggish liver slows down digestion. Toxins build up, leading to a queasy stomach. Reduced bile means you don't digest fats well, leading to heaviness and nausea. In more advanced liver disease, anorexia, the clinical term for appetite loss can lead to dramatic, unintentional weight loss. You may also experience early satiety, where just a few bites make you feel full. If you're eating less but your abdomen is growing, that's an urgent red flag. 5. Unexplained weight loss or muscle wasting. Muscle wasting, especially in the upper arms, thighs, and shoulders, is a visible and serious sign of chronic liver disease. This happens because the liver can't process proteins properly. You lose appetite and stop eating enough. Chronic inflammation breaks down muscle tissue. Even if your body weight is stable, you may notice shrinking limbs, protruding bones, especially collarbone or shoulder blades, weaker grip strength. Sarcopenia. Age-related muscle loss is common, but rapid or disproportionate muscle loss should always be evaluated for underlying liver problems. 6. Yellowing or darkening of the urine. Just like the eyes, the color of your urine can reflect liver dysfunction. The presence of excess bilirubin in the blood spills into the urine, giving it a dark amber, tea-like, or cola color. If your urine is dark despite drinking plenty of water, foamy, indicating protein leakage, has a strong odor despite no infection, it may point toward liver inflammation or bile duct blockage. This is especially concerning when combined with pale stools, fatigue, or yellow skin. 7. Constant fatigue or brain fog. Your liver converts nutrients into energy. When it's not working properly, toxins like ammonia can accumulate in the bloodstream and even reach the brain, resulting in brain fog, forgetfulness, irritability, and mental fatigue. This condition is called hepatic encephalopathy in advanced cases, but earlier stages may look like feeling tired even after sleeping well, difficulty focusing, remembering, or making decisions, trouble following conversations or completing tasks. Brain fog and low energy are common complaints in older adults, but when combined with other liver signs, they become a major clue. 8. Frequent indigestion, burping, or feeling of fullness. Your liver supports digestion through bile production, and any reduction can cause sluggish digestion and pressure in your upper abdomen. This may feel like burping or acid reflux after eating, bloating even with small meals, gas or heaviness in the stomach. Some patients describe a brick in the stomach sensation, especially after fatty meals. This is because bile isn't adequately emulsifying fats, making digestion slow and incomplete. 9. Persistent hiccups or belching. Chronic hiccups or excessive belching may seem minor, but in some cases, they're linked to diaphragmatic irritation from an enlarged liver or acidic fluid pressing upward. If you notice hiccups lasting more than 48 hours, hiccups combined with bloating or nausea, belching unrelated to food or carbonated drinks, it could be a subtle indicator of liver dysfunction or increased abdominal pressure. 10. Enlargement of the liver. Hepatomegaly. In the early stages of liver disease, the liver may actually enlarge before shrinking due to scarring. If you lie flat and press gently under your right rib cage, you may feel a firm or tender mass, discomfort when bending or sleeping on the right side, pressure radiating to the back or shoulder. A physician can usually confirm this during an exam or with imaging. Enlargement can occur in fatty liver disease, hepatitis, or congestion from heart failure. 11. Persistent hiccups or bloating after meals. If every meal leaves you feeling overstuffed or you experience daily hiccups for no clear reason, your liver might be behind it. The cause may be an enlarged liver pressing upward against the diaphragm or poor bile flow causing food to sit longer in your stomach. This sign often goes unnoticed until it becomes chronic. If your meals are light but leave you bloated for hours, investigate your liver. 12. A feeling of fullness under the right rib. This final sign is subtle but critical. Many people with liver disease describe a dull fullness or pressure sensation just beneath the right rib cage. This may indicate liver inflammation, hepatitis, congestion due to poor blood flow, a fatty or enlarged liver pressing against nearby organs. This discomfort is often mistaken for gallbladder problems or digestive issues, but when accompanied by fatigue, jaundice, or digestive changes, it strongly points toward liver distress. Let me know when you're ready for Chapter 3, which will focus on behavioral and emotional symptoms, nail and hair changes, and how liver disease alters how you look, act, and feel on a daily basis. Your liver is often called the silent organ, but it's not silent if you know where to look. As liver function declines, the signs don't just stay hidden inside your body. They begin to surface in places that are visible every single day: your face, skin, hair, nails, and even the way you behave. These changes are especially relevant to those over 60 because age increases susceptibility to chronic liver conditions, especially fatty liver, hepatitis, and medication-related liver toxicity. In this final chapter, we'll decode the visible warning signs that you may see in your mirror, feel in your emotions, or experience in your confidence and clarity. Each sign is your body's attempt to alert you that something beneath the surface needs urgent attention. 1. Yellowing skin and eyes. Jaundice. One of the most obvious signs of liver dysfunction is jaundice, a yellow tint that appears in your skin and especially the whites of your eyes. It happens when bilirubin, a yellowish pigment normally processed by the liver, builds up in the blood because your liver can't handle it. What to watch for? A subtle yellowing in the inner corner of the eye. Overall yellow glow under natural light. Dark urine or pale stools often accompany this. Jaundice is often the first visible symptom people notice when liver disease becomes serious. In elderly individuals, it might develop slowly and be mistaken for aging or fatigue. But even a slight yellow hue is an urgent red flag. 2. Spider angiomas. Red spider veins on the skin. These small, spider-like clusters of blood vessels, usually seen on the face, chest, neck, or arms, are called spider angiomas, and they're strongly associated with liver cirrhosis or hormonal imbalance caused by liver damage. How to identify them? Tiny red in the center with thin blood vessels radiating out. They blanch, turn white when pressed, often appear in clusters. They're most common in people with chronic alcohol use, hepatitis, or cirrhosis. The liver normally metabolizes estrogen. When it fails to do so, estrogen levels rise and spider angiomas form. 3. Facial redness or flushing liver face. Have you noticed a persistent red or ruddy complexion, especially across the cheeks and nose? Some call this the liver face. It's caused by increased estrogen, poor detoxification, and dilation of facial capillaries. Common features: blotchy, uneven skin tone, broken capillaries across the cheeks or nose, warmth or burning sensation in the skin. This sign is often confused with rosacea or sun damage, but when combined with other liver symptoms, it points to liver congestion or inflammation. 4. Hair thinning and loss. Hair health is directly connected to liver health. The liver stores iron, regulates hormones, and filters toxins, all of which affect hair growth. What to notice: thinning hair on the scalp, especially at the crown or temples. Brittle hair that breaks easily. Premature graying or dull appearance. When your liver fails to metabolize nutrients properly or manage hormonal balance, the result is weak hair follicles. For older adults, thinning hair may seem normal, but rapid or sudden loss often signals liver issues, especially in conjunction with fatigue, weight loss, or poor digestion. 5. Bad breath or a metallic taste in the mouth. Known as fetor hepaticus, bad breath related to liver disease has a sweet, musty, or metallic scent. This happens when toxic substances that the liver fails to process, such as dimethyl sulfide, accumulate in the bloodstream and are released through the lungs. Clues: persistent bad breath not linked to oral hygiene. A metallic taste that ruins food flavor. Thick coating on the tongue, especially in the morning. This is a warning of deeper liver toxicity and must be taken seriously if it continues despite brushing, flossing, or using mouthwash. 6. Red palms, palmar erythema. When you notice the palms of your hands are unusually red, warm, or blotchy, you could be witnessing another visible sign of liver disease. It's called palmar erythema and is directly linked to changes in blood flow and hormone levels caused by liver dysfunction. Check for both palms affected. Redness that doesn't fade over time, accompanied by itchiness or tingling. This symptom can appear years before a formal liver diagnosis. If your hands are frequently red without exertion, take note, especially if spider veins or fatigue are also present. 7. Itchy skin, especially at night. Itching without a rash may seem harmless, but in liver disease, it's a clue to bile buildup in the skin. Known as cholestatic pruritus, this itching is often most intense at night, focused on the palms, soles, back, or limbs, not improved by moisturizing. This type of itching is internal, caused by substances like bile acids leaking into the bloodstream and irritating nerve endings in the skin. Scratching doesn't bring relief and may even cause bleeding or bruising. If you're itchy for no clear reason, it may be your liver crying out for help. 8. Easy bruising or bleeding. Your liver produces proteins that help your blood clot. If it's not working properly, you may find you bruise from the slightest bump. Small cuts bleed longer than usual. Nosebleeds or bleeding gums become common. Older adults often bruise more easily, but sudden or severe changes in bruising patterns can indicate liver trouble, especially when accompanied by spider veins, fatigue, or swelling. 9. White nails or clubbing of fingertips. Your fingernails are a surprisingly useful health indicator. In liver disease, nails often turn pale or completely white, show horizontal ridges, develop a curved, bulbous shape clubbing. White nails indicate anemia or low albumin, a protein made in the liver. Clubbing occurs due to low oxygen in the blood, often seen in chronic liver failure. If your nails have changed shape or color without injury, get them checked. 10. Skin discoloration of dark patches or yellow spots. Liver disease may lead to pigmentation changes such as hyperpigmentation, dark patches on the face, neck, underarms. Yellow bumps on the eyelids, xanthelasma, due to cholesterol buildup. Bronze or gray tint, seen in some types of hemochromatosis or chronic hepatitis. These signs develop gradually and may be confused with sunspots or aging, but sudden or spreading discoloration is often a clue that your liver is struggling to filter toxins or regulate fat metabolism. 11. Swelling in the face or puffiness around eyes. While liver swelling often appears in the belly and legs, some people also develop facial puffiness, especially around the eyes and cheeks. This is due to fluid retention or poor circulation. Things to notice: puffy eyes in the morning, swelling that doesn't resolve with rest, general facial fullness despite weight loss elsewhere. Liver dysfunction may cause hypoalbuminemia, low albumin levels, which lets fluid leak into soft tissues like the face. This may also be why some people with liver disease appear puffy despite fatigue and malnutrition. 12. Mood swings, anxiety, or depression. The liver doesn't just affect the body, it also influences the brain. When it can't properly filter toxins, your mood, sleep, and mental clarity suffer. Signs of emotional liver distress: sudden anxiety or panic attacks, depression, hopelessness, or withdrawal, irritability and short temper. This isn't all in your head. The liver regulates neurotransmitter function and hormone balance. Seniors may brush off emotional changes as part of aging, but when mood shifts happen alongside fatigue, digestion issues, or visible skin changes, it's time to investigate the liver. Conclusion: your liver may be hidden deep inside, but the signs of its health or its distress are written all over your body. From the color of your eyes to the texture of your nails, from the smoothness of your skin to the clarity of your mind, the clues are there. If you've noticed even 2 or more of these signs, it's not about panic, it's about early action. Regular liver tests, proper nutrition, and reducing alcohol and toxic medications can go a long way in supporting your liver and reversing early damage.